Issues at hand, WBS TV. Peter Kiwazo with Moses Kamabare, the MD of National Medical Stores. Christopher Mukalazi, thank you very much. And my anonymous doctor, thank you very much as well. The anonymous doctor, I'll read the message before we go to my question. The anonymous doctor says, Peter, I work with the National Referral Hospital. I won't read the unit because then possibly your anonymity will be lifted. And she says that every time she travels, she has to stack up special medicines that she's bringing to the particular unit she's working with. And she says NMS only supplies basic medicines. And she says National Referral Hospital, basic medicines, no.
We supply the medicines that the National Referral Hospital requisitions from National Medical Stores. And if they ask for the basic medicines, we will give them the basic medicines. But as I have explained in several other fora before, is that if you count the number of patients who actually are in Mulago, those ones that need the basic medicines constitute about 80% of the people who go to Mulago Hospital. And it is therefore not a surprise that even Mulago Hospital will requisition for those basic medicines and medical supplies for them. What we've seen as a challenge in this country is that the referral system has completely broken down. There is, you see mothers, you see people walk themselves into the National Referral Hospital. That is unacceptable. In a setting in other countries, you simply cannot do that. If you walk yourself to a National Referral Hospital or a referral hospital, it might even be a regional referral hospital, they would refer you to the private wing. You have your money, you pay. But for the public, the National Referral Hospital would be for people who have been referred, not by a health center, not by a general hospital, by a regional referral hospital. Meaning that that case cannot be managed at that level. They have referred them for...
Of course, that system doesn't quite work here.
It doesn't work at all. Not that it doesn't work at all. And therefore, Mulago Hospital, Mulago management has to face the reality on the ground that the system has broken down and now they are firefighting. They are simply trying to manage the crisis. But it is, and we have urged this. Many people that you talk to in many other people, people that have that should know better, they will tell you, no, Mulago, anybody should be able to go there. And I've asked them, it doesn't happen even in education. You cannot just walk from senior 4 and you walk yourself into Makerere University. It doesn't work. Nobody will accept you there. Nobody will admit you there. Nobody will accept you to go in the lecture room and be taught. Why is it that people walk themselves from their own homes with simple flu, with just a normal delivery, and they walk themselves into Mulago Hospital and they congest it, and it's acceptable in this country? We should refuse to accept some of these things.
Salongo Chimbugwe says, Kiwazo, the gentleman did not answer whether we have a shortage in supply generally, and therefore people can only receive medicines where I am in Rebitomi, that one. He says, where I am in Rebitomi, people know the week in which medicines arrive and they are supplied, and after that week, they burn out and no more. So, do they supply us short? Please let him answer. And also, who sells to the private pharmacies? How is it possible that here, if you go to Mbarara, every medicine they need in the hospital where I have been is available in certain pharmacies that I want to mention in Mbarara, but not available at national health centers? How is this possible?
If I may start with the question of my brother, I think Chimbugwe, who is talking about sufficiency of supplies. That is a question that is philosophical. We've been talking about it for a long time. And we cannot, considering the kind of challenges that we have, we can't even go out there and say the medicines or the money is not enough. What we can only say is this is the budget that you have been given, and if you fit within that budget, and by the end of the financial year you have utilized your money, as NMS we have discharged our responsibility. Now, We have also in the past and in also various fora urged the following, that many of the diseases that we take, Chivazo and myself and other Ugandans, that we take to hospitals, be it government or private, these are diseases that we should not be taking there. These are diseases that are preventable. We have statistics in this country that clearly indicate that 75% of the conditions that we take to hospitals, to health facilities, are actually preventable. Meaning that, in simple terms, in very basic terms, it means that out of the 100 people that you find in a health facility, 75 should not be there. The genuine patients who should be attended to are 25. Now, the question is, why don't we prevent those diseases that we should prevent? Why are we loading it over the health system, the health workers, and then we start saying the health workers are not enough, the supplies are not enough? We should be able to prevent all these things. 75%, Peter, of the people, of the 100 people that you met in Mulago should never be there if they did certain things, if they took their responsibility seriously. If somebody knows that I am supposed to use an insecticide-treated mosquito net to sleep under there, you don't,
So
and
Moses,
then you complain. Yes, please.
The answer is we don't have shortages.
The answer is you would never know whether we have shortages, because you can't even plan for people who are not responsible. You don't.
Then answer the other one, the one in Mbarara that says, how is it possible that where he is in Mbarara, when the public hospitals don't have medicines, these medicines are the same medicines that are available at private dispensers? And he's wondering, how is this possible that you don't and they do?
Peter, you have also given the same example, that you were in Mulago, they did not have certain supplies, basic supplies, and they are referring you to Wandege.
Yes.
I have said this before, that it is not possible that any health, any pharmacy, any individual, because those pharmacies are owned by individuals or groups of people, can have more money than government. It is not possible. And I have been trying to labor to explain to Uganda, it's not possible. It is just poor planning. It is simply not possible that the government cannot have the medicines that are stocked in the other facilities. What we need to do is to ensure that we prioritize the medicine. If we think that the funds that we have are not enough, is not everything that we need, knowing that anyway we will never get all that we need. We need to procure those medicines and those medical supplies that actually that are taking care of about majority of the conditions that
Stella Nampel says, Peter, I need an answer to this. I don't know whether it is me that has a problem. But how is it possible that we have shortages of supplies? Medicines are very expensive, but at the same time, we are paying expensively to dispose of expired drugs. That gentleman was in Parliament, and he was giving among his priority funding list monies to dispose of expired drugs. No, 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 no. Drugs should not expire in a country where we have shortages. Nampeo.
Drugs will expire in countries where they have shortages. There is no country in the world that has all the medicines that they need, including our country here. Drugs and other medical supplies, everything that has an expiry date will expire. You will go in a supermarket, you'll find expired stuff, and you'll go out and find the people who need that stuff and they can't get it. So what should worry my sister there and any other Ugandan is not the fact that medicines have expired. It should only be the value of the medicines that have expired. And we have always indicated this to the members of Parliament, to everybody that wants to hear this, that the extent of expiry in national medical stores, in your national medical stores in Uganda, is among the lowest, if not the lowest in the whole world.
Father
Kabuye,
he doesn't say of where. Father Kabuye says, Chibazo, can that gentleman tell us how come the joint medical stores supplies and monitors what they supply to the Christian hospitals?
I would know. I don't work for joint medical stores, but what I know is that Kivazo and any other Ugandan who has been to those hospitals you sometimes get prescriptions and they tell you to go and buy medicines from outside of those hospitals. So you cannot even tell me, even where you are paying, even when you go to Nakasero Hospital, at times they will give you a prescription. Those are the people, that is where you take money. They would even want to make a profit out of the medicine that they give you. But sometimes they give you a prescription and tell you to go out. So the issue of monitoring, the issue, I don't even believe, and I know as for a fact with the people that I have discussed with, joint medical stores will not ask you to account for the medicines that they give you, that they have delivered to you, before they can give you another loan. You will take your order and they will give it to you.
As we exit, do you think as a team at the strategic management level of the health systems of this country, you're failing us?
No, we are not failing us. We are actually serving you very well. What Ugandans don't pay attention to is the lives. You see, the health system is supposed to save lives. The health system does not treat death. The health system saves lives. And I can tell you, if you go to Mulago Hospital or any other hospital, you look at the mothers that are being saved, that are being helped to be delivered. They are more than 10,000 times more than actually the number of mothers that have died. But what the media is putting out there is like, what happens is when you go to a government health facility, you be sure you are going to die while delivering. But I can tell you that any hospital, from Mulago Hospital to Health Center 3 down there, those health workers, they are spending sleepless, they are saving lives. And I can tell you, if you look at the statistics of the people that have entered those hospitals and come out live and they are healthy, they will actually tell you how well things are going. But of course, we need to do better.
Do you undersupply health centers?
We don't undersupply health centers.
The gentleman was talking about Health Center 3s that are receiving supplies for Health Center 2s.
Those are the challenges that we've been telling the local governments. Because when people in between the financial year, somebody will just say they upgrade. A local government seats that the councillors have sat and upgraded a Health Center 2 to a Health Center 3. I mean, you cannot just upgrade. To move from a Health Center 2 to Health Center 3 has cost implications. As you've heard, that the medicines for Health Center 2 are different from Health Center 3. So have you sent a requisition through your member of parliament, through finance, to also get a bigger budget next financial year because you have upgraded and therefore your demand for medicines has gone up? You have not done that.
We have to go.
You blame it on national medical
We have
stores.
to go. And I can assure you, viewers, we are going to invite Moses again, possibly on another show. And this time we are going to talk about some other issues. Who approves the drugs that are supplied in Uganda? Who has that stamp that says it is Coartem, it is not quinine, that is the drug of choice? Who monitors their procurement as national medical stores? Who approves their procurements? Is there abuse at this level? And we'll invite him for another discussion on another day. Good evening.